Hello, my name is Grace, and this is my global comparison of social policies presentation, a comparison and analysis of the United Kingdom's and the United States CARE Acts and policies for my MSW 602 Social Problems and Social Welfare Program class. Throughout this presentation, I will analyze and compare the different policies associated with caregiving, mental health treatment, and the government's involvement in healthcare systems. I will highlight the different value systems, commonalities, and differences, and reflect on the inclusivity and justice of both countries' policies, assessing their effectiveness in supporting diverse populations and promoting social equity. In the United States, the Affordable Care Act, or the ACA, was established in 2010 and implemented a new set of patients' bills of rights that took effect, shielding consumers from the worst abuses by the insurance industry. Because of this act, many Americans gained access to preventative services at no cost, such as annual visits, physicals, public exams, and more. Originally, the ACA focused on putting insurance coverage information for consumers online, prohibiting the denial of coverage for children with pre-existing conditions, and banning insurance companies from rescinding coverage, while also eliminating lifetime limits and regulating annual limits on insurance coverage, ensuring the right to appeal insurance companies' decisions, and establishing consumer assistance programs in the states. Throughout the years, this act has been adapted, and starting in 2014, the law established new consumer protections, including prohibiting discrimination based on pre-existing conditions on gender, eliminating annual coverage limits, and ensuring coverage for individuals participating in clinical trials. It also improves access to affordable care by offering tax credits for middle-class families, establishing a health insurance marketplace for individuals and small businesses, expanding Medicaid eligibility, and promoting individual responsibility for health coverage. The United Kingdom's CARE Act of 2014 replaced most previous laws regarding both caregivers and the individuals they cared for. This act outlines how local authorities should conduct caregiver assessments, determine eligibility for support, set charges for residential and community care, decide whether to charge for caregiver support, and fulfill their responsibilities in providing assistance. The CARE Act primarily focuses on adults who need care and support, as well as their adult caregivers. While it includes some provisions for children transitioning to adult services, parent caregivers of children in need of care, and certain younger caregivers, the main provisions for these groups are outlined in the Children's and Families Act of 2014. Forming the basis of society and identity, there are four fundamental British values in the UK: democracy, rule of law, respect and tolerance, and individual liberty. In regards to individual liberty, the UK CARE Act of 2014, as a law, is geared toward the care and support of people through both a collective and individual lens or approach. Originally introduced by the Department of Health in 2011 and now embedded in the CARE Act, these six principles: empowerment, prevention, proportionality, protection, partnership, and accountability apply to all health and care settings. Similarly, in the United States, there are six basic American culture values, which include individual freedom, self-reliance, equality of opportunity, competition, the American dream, and hard work. The National Association of Social Workers, or the NASW, outlines key values and principles of social workers as service, social justice, dignity and worth of a person, importance of human relationships, integrity, and competence. These six basic American cultural values and the key values outlined in the NASW both emphasize principles that prioritize individual fairness and the well-being of society. While American culture values, such as individual freedom, self-reliance, and equality of opportunity, focus on personal empowerment and achievement, the NASW values emphasize social justice, service, and the dignity of every person, aiming to ensure that those in need receive support and respect. Both acts' values stress the importance of human relationships and integrity, but the NASW Code of Ethics specifically addresses the professional responsibility of social workers in promoting these values through ethical practice, while American cultural values highlight broader societal ideals that encourage personal growth and communal prosperity. Together, they reflect a shared commitment to fostering a society where individuals have the opportunity to succeed and are treated with dignity and fairness. The comparison between British and American values reveals a distinction in emphasis on individualism versus collectivism. While American values strongly prioritize individual freedom, self-reliance, and personal achievement, reflecting a more individualistic culture, British values and the CARE Act of 2014 also emphasize collective responsibility, particularly through social welfare laws and that balance individual liberty with societal support, focusing on both personal care and community well-being. This highlights a contrast in how each country's values personal autonomy and equity, with the UK adopting a more collective approach to social care, while the US places a greater emphasis on individual empowerment and opportunity within its cultural framework. The two key commonalities between the UK CARE Act of 2014 and the Affordable Care Act of 2010 are focus on equity and access to care. Both laws aim to improve access to care for vulnerable populations. The UK CARE Act focuses on ensuring that adults in need and care and support receive appropriate services, while the ACA focuses on expanding health insurance coverage and improving access to health care for individuals, particularly those who were previously uninsured or underinsured. Protection against discrimination. Both acts include provisions to protect individuals from discrimination. The UK CARE Act prohibits discrimination based on an individual's need for care and ensures people receive services based on their needs rather than personal characteristics. Similarly, the ACA includes protections against discrimination by insurers, such as prohibiting denial of coverage based on pre-existing conditions and ensuring coverage regardless of gender or health status. The two significant differences between the UK CARE Act of 2014 and the Affordable Care Act of 2010 are the scope and focus. The UK CARE Act of 2014 primarily addresses the social care needs of individuals, focusing on providing support and services for adults with care needs and their caregivers, such as provisions for assessing care needs, eligibility for services, and the duty of local authorities to ensure people are treated with dignity and respect. The Affordable Care Act of 2010, on the other hand, is focused on a healthcare reform specifically aiming to increase health coverage, help reduce costs, and improve the quality of care in the U.S. It includes provisions for expanding Medicaid, creating health insurance exchanges, and regulating private insurers, but does not directly address social care services like the UK CARE Act. Another difference is government's role in care delivery. The UK CARE Act places a significant responsibility on the government and local authorities to directly provide or arrange care and support for individuals in need. It addresses a duty of care from the state level to ensure that the vulnerable populations receive necessary services with an approach based on individual and collective responsibility. The Affordable Care Act, while expanding access to health care, does so primarily by regulating private insurers and expanding government programs like Medicaid rather than directly providing care. It relies more on private market solutions and individual responsibility alongside government-funded programs, creating a more market-driven healthcare system rather than the UK's publicly funded model of social care. Personally, I prefer the UK CARE Act of 2014 primarily because of its effectiveness in promoting a more equitable and inclusive social care system. It also is in alignment with the key NASW principles and ethics, particularly its focus on social justice, dignity and worth of a person, and the importance of human relationships. The Act's focus on person-centered care ensures that individuals, regardless of background or financial situation, have access to tailored care that respects their dignity and supports their autonomy. It emphasizes on caregiver support is also a significant strength, recognizing the vital role that caregivers play in the systems, which may be overlooked in other policies. Additionally, the universal eligibility threshold and national consistency in assessments promotes fairness, ensuring that care needs are met based on individual circumstances rather than geographical location or income. Overall, the CARE Act's holistic, comprehensive, and inclusive approach reflects the core values of NASW's Code of Ethics by addressing the diverse needs of vulnerable populations, improving social justice, and fostering a more inclusive society, which I believe are critical components of a sustainable and a compassionate care system. The UK CARE Act of 2014 is a comprehensive piece of legislation that focuses on providing support for adults in need of care and their caregivers, and ensuring services are based on individual needs and preferences, with a significant role for local authorities in coordinating and providing care. Implementing a similar model in the United States could face significant challenges due to the country's distinct cultural, political, and economic context. The UK CARE Act places a strong emphasis on a collective responsibility for the care of vulnerable populations with a welfare framework that assumes public responsibility for individuals' well-being. The idea of universal access to care and government-mandated services is embedded in the UK's cultural values, which prioritize social safety nets and solidarity. In contrast, in the United States, we have a more individualistic culture that values personal responsibility and self-reliance. This cultural preference for individual freedom and a limited role of government in personal affairs could make the widespread acceptance of a care model like the UK CARE Act challenging. Many Americans are skeptical about expanding government intervention into social care due to concerns over higher taxes, increased control over health and social services, and the potential for system inefficiencies such as lengthy wait times and stifled medical entrepreneurship and innovation. The political climate in the US is significantly different from the UK regarding the government's involvement in social care. In the UK, public services like the National Health Service, or NHS, has long been established with a broad political consensus around the role of government in providing care and support for the population. The CARE Act reflects this consensus and builds upon an existing framework where local governments have the mandate and resources to deliver care services. In the United States, however, there is considerable political polarization around issues such as healthcare and social services. While the ACA was a significant step toward expanding healthcare coverage, it was heavily contested and continues to be a point of political division. Additionally, Medicare and Medicaid, the primary medical federal programs providing care for low-income individuals and the elderly, are often under political scrutiny and face proposals for cuts and policy reforms. Given the difficult political opposition to government-driven and the government's involvement within healthcare systems, I believe that it would be difficult to pass a law like the UK CARE Act that mandates broad government-provided care across all states. Economically, the US faces different challenges compared to the UK in terms of funding public services. The UK CARE Act is supported by a tax-funded system that draws from the collective wealth of population, allowing for centralized coordination and delivery of care. The UK also has mechanisms in place, like NHS, that helps distribute care resources effectively and efficiently to individuals. In the US, however, healthcare and social welfare systems are fragmented with a mix of private insurance, employer-sponsored programs and plans, and government programs. Expanding a system like the UK CARE Act would require a massive public investment and reorganization and reevaluation of how care services are provided. The United States spends a substantial amount of money on healthcare, with an estimated $12,742 per person in 2022, the highest healthcare cost per capita among wealthy nations, but these costs are often unevenly distributed across individuals, private insurers, and the government. By implementing a comprehensive publicly funded care model would likely require substantial tax increases or restructuring of existing social programs, which would face significant economic and political pushback. There are three key challenges that could hinder the implementation of the UK CARE Act in the US. The US has a fragmented healthcare system with a mix of private insurance, employer-based coverage, and public or government programs. The UK CARE Act operates within a system where local authorities manage and provide care services directly, which would require a massive overhaul in the US healthcare system delivery. Given the US's strong political cultural of individualism and limited government intervention, especially through conservative values, there is likely to be a significant resistance to the implementation of a publicly funded care system that provides government mandated services. A policy like the UK CARE Act would face considerable opposition from conservative groups and lobbyists, particularly within the healthcare and insurance sectors. Lastly, funding a universal, government-driven, and government-involved care system would require an extensive public funding program and the establishment of mechanisms for managing care services nationwide. The U.S. would need to increase taxes or reallocate resources from existing programs and or create new frameworks for local care provision, challenges that would require a significant political and economic overhaul. While the UK CARE Act of 2014 provides a strong model for a comprehensive approach to social care, implementing a similar system in the United States would face substantial cultural, political, and economic challenges. The individualistic culture, political resistance to large-scale government intervention, and economic cost would make it difficult to adopt such a model wholesale in the United States. However, incremental reforms such as expanding Medicaid or introducing more robust long-term care programs could lead to potential pathways for improving care for vulnerable populations in a way that aligns with the American values of self-reliance and individual freedom while addressing gaps in care access. The UK CARE Act of 2014 promotes social justice by ensuring equitable access to care, protecting vulnerable groups, and providing personalized care that empowers individuals to make choices about their support. It addresses inequities by mandating local authorities to address needs fairly, regardless of financial or geographic barriers, and includes support for unpaid caregivers, recognizing their critical role in the care system. The Act honors diversity by emphasizing culturally sensitive care and ensuring that diverse needs of individuals, including those from marginalized or minority groups, are considered in the care planning process. These principles could inform social policy development in the U.S. by advocating for a more integrated social care system that addresses the diverse needs of a growing and varied population. In particular, the U.S. could adopt more comprehensive caregiver support programs and improve equity and access to care, especially for those in vulnerable populations such as racial minorities and low-income communities. The UK CARE Act of 2014 and the ACA both represent significant efforts to address the needs of vulnerable populations, though they operate within different cultural, political, and economic contexts. The UK CARE Act focuses on providing a comprehensive social care support, emphasizing equity, individual choice, and caregiver support with a strong commitment to inclusivity and cultural sensitivity. In contrast, the ACA primarily targets healthcare reform through expanding insurance coverage, addressing health disparities, and improving access to care, but faces ongoing challenges in terms of affordability and political opposition, highlighting the complexities of the universal healthcare system in the United States. Thank you for watching this presentation. Please click the following link to provide any feedback that you may have. Thank you.